Hi, hi, and welcome to my Instagram live, in which I'll be talking with Dr. Funke Afolabi-Brown about sleep and how it affects ADHD kids. Welcome to my Instagram live, where I will be talking to Dr. Funke Afolabi-Brown about sleeping, ADHD, and how it affects the kids. So hold on while I add her to hold on while I add her to the live. Hi. For whatever reason, it's not. Okay, there you are.
Hi,
Hello.
how are you?
I'm good. I'm good. I'm good.
Good to
I was like, I
see you.
can't seem to get this thing to work right.
I know it's that is what can we say? That's the age we're in. You just keep trying, and we're here, right? Good to
Yes,
see
we
you.
are. Hi. How are you?
I'm really well. I'm excited to be here.
Great. So I'm gonna tell our viewers a little bit about you. Dr. Funke Afolabi-Brown is a board certified sleep physician, and she's also the founder of Restful Sleep MD. She helps busy moms and their kids sleep well so that they can thrive and reach their full potential, right?
Yeah, yeah, that's me.
Okay, so here's what I'd like to know. I would like you to tell us why sleep is important because people like me, I tend to kind of take sleep for granted.
Mm.
I might have 5 hours of sleep at the end of the day. But why is sleep important?
Yeah, so I think the first thing, and honestly, you're not the only one that's, you know, we sometimes we understand why sleep is important, but really actually implementing it is the problem. Like at the back of your mind, you're like, yeah, I probably should sleep well because if I don't sleep well, I kind of feel a little more crappy. I feel a little moody. I'm yelling more at my kids or, things like that. But sleep is not just a cure for sleepiness, right? It's not just something you do at the end of your day because work never ends. So even if we had, prehistoric times where it would be dark and you have no other choice but to sleep because there was nothing else to do. Now there's enough to keep you going like 24/7, which is why it's just beyond what we're doing at the end of the day. Sleep is the time to actually heal.
Really?
It's the time our bodies need to recover and be restored because especially if wherever stage you're in, you're learning, you're processing information, you're building relationships, you're eating healthy or eating right, all your body functions are going right. You're using your brain, you're using your mind, your heart is pumping. All those things need a time to actually rest and recover. If you're someone who is, even just exercising, right? You're exercising, you're going on walks, you're trying to maintain a healthy lifestyle. To be able to pair those things we do during the day with just having the best impact, we need sleep. So I talk about from the top bottom. So even just for brain health itself, right? We now know that there are substances that build up on the surface of our brain over the course of the day. And so when we sleep, we actually have these systems in our brain. It's called the glymphatic system that essentially expands and contracts, and actually cleanses our brain of those deposits. Because if they stay on, some of those substances, one of them is called amyloid beta, has been shown to be responsible for or to be part of what causes Alzheimer's, right? So
Oh,
then we may start
really?
to have memory issues if we don't sleep well. But then another thing, yeah, exactly. And this was recent too. And then another thing I always talk about is again hormone secretion and regulation happens during sleep. So growth hormone, which we all need, not just children need growth hormone. So if children don't have time where they're sleeping well, they don't have good production of their growth hormone, they may have growth problems, right? But even for us as adults, it's that same growth hormone that allows our muscles to heal, our bodies to recover, um, you know, our metabolism. So being able to have normal, blood sugar levels, normal heart function, normal blood pressure, all those things happen during sleep. So a whole lot of things happen, and I think sleep is really important.
For this reason.
So
Wow.
many.
Okay.
Yeah.
So I've learned a bunch of things today. So sleep is essentially restorative. It helps our brain function. It can also provide some protection against Alzheimer's because of the lymphatic system,
Mm.
right? Oh, that's that. No, I did not know that. That's really interesting. That's very, very interesting. So, about how many hours a day do you think that the average person should sleep? The average kid, the average grown
Mhm.
up?
So the ranges vary. Um, the National Sleep Foundation and actually the American Academy of Sleep Medicine has these recommendations that vary by age. So infants, for instance, or newborns would sleep anywhere. They sleep most of the time. And they're sleeping so much because they need it. It's so important for their growth and their development, right? So they sleep anywhere from 14 to 17 hours. And then we have, like, toddlers that sleep anywhere from about 11 to 14 hours, and then school age children from 9 to 11 hours. And then our teenagers sleep 8 to 10 hours, or they need 8 to 10 hours, while adults usually will talk about 7 to 9. So it's a wide range. I don't like people obsessing too much about the numbers. I think it's important to have the numbers as a guide, right? But you're not going to try to, if your child is like 9, right? If they sleep 11 hours, I don't want you to try to force them to get more, or you know what I mean? Because it's a range. And so, more importantly, beyond just the number of hours of sleep is the quality of sleep. So that's also a very big part that we need
That
to
is
pay
important.
appointed to, pay attention to.
Okay. All right. So, um, length of sleep, quality of sleep, really important. How does ADHD affect sleeping kids?
So it's almost like it's when you think about sleep, or poor sleep, or insufficient sleep, or whatever, poor quality sleep, it literally gives you a little bit of ADHD like symptoms, like everybody. So we have people who, from the moment, and even your children, from when if they have a bad night of sleep, you can tell, right? They may tend to be more impulsive, they may tend to be more hyperactive. You might actually not notice, unlike adults, where if we don't sleep well, we might feel sleepy, we might feel sluggish. Our children tend to be the opposite. They may have increased energy, they may be harder to sort of calm down, and they may have emotional dysregulation. So we see all this, and we sometimes talk about ADHD like symptoms, right? I'm not saying poor sleep will give you ADHD, but then there's some of those symptoms you
Just
see
symptoms.
in people that have ADHD that you already even see when people don't sleep well, which is why, I mean, even from my practice and my experience, what I've seen is that people actually get diagnosed. And I'm not at all saying that ADHD is not as prevalent as it is, but I've had people who have had a diagnosis of ADHD that are sent to me because maybe they're already on medications, they're already on all these things, and their sleep has been bad. And we've been able to work on their sleep, and sometimes we're able
And
to come
eliminate
back.
those
Yeah,
symptoms.
yeah,
Wow.
we've been
Wow.
able
Okay.
to. So
So,
again, all those things: impulsivity, inattention, very labile mood, um, poor focus, poor academic performance, so many other things. Impact anxiety. Anxiety is a big one as well. Affects children with ADHD. And I would say in a relatively exaggerated fashion. So definitely one of the things we want to pay attention
So
to.
essentially, a pediatrician like me needs to do a really good like sleep history when I'm evaluating these kids for ADHD. All right, really good take home.
And I'm sure you are already.
Yes, I am. I mean, because that's important. You're
Yeah.
right. It also affects anxiety and
Hmm.
depression because if the kids can't sleep, then it's kind of like a really bad, like,
Cycle. Yeah.
yeah, cycle.
Mm.
Yeah, it just gets worse. So yeah. So you've just kind of touched on common effects of lack of sleep in kids and teenagers. So I'm going to ask in that case, what strategies can we put in place to eliminate this, sleep? What are the two, or shall I say, what are the three commonest causes of lack of sleep that you tend to see in your practice, in kids and teenagers? What are the three commonest things?
With ADHD or just
Oh, no,
generally?
just
Yeah.
generally in kids, because it's all the same,
Yeah.
whether they're ADHD kids or otherwise.
Yes.
It's pretty much the same.
Yeah. So I think one of the common things, and now, usually when we're talking about sleep issues, I really usually try to put it into three categories because when people come and they're like, my child's not sleeping, nobody's sleeping, it's horrible, horrible, horrible. We try to figure out why, because when we figure out the why, then I could tell you whether all you need is, oh, you just need a good sleep hygiene versus, okay, we need to rule out a medical sleep disorder versus, you know what, this needs to really be addressed in a different manner. So we talk about behavioral sleep issues. So those are things like routines, right? Some kids want to spend time on their devices. Some kids are fighting bedtime. Some kids don't have a consistent sleep time, wake time. So those are more of the behavioral, or some kids just need a parent to be present for them to sleep. They just really want a parent present. So those are more of the behavioral pieces. And then the middle one is more of this medical issues, right? So things like sleep apnea, which is, it's common in children. It's not as common when you look at the overall prevalence in adults, but it's there. Restless leg syndrome, and we're finding out that children with ADHD actually have a higher incidence or they're more at risk for things like restless leg syndrome. Restless leg syndrome is this discomfort that you might have in your legs or in your arms that may get in your way of sleep. So some kids, until you ask, you would absolutely not be able to find that out, and that can delay their sleep time. And then we have other things like, if you have a medical, if you have, yeah, I don't know, asthma or reflux or things like that that can disrupt their sleep. Those are definitely things you want to pay attention to. So medical history is also very important, even when we're taking within the context of our sleep history. And then the final bucket is kind of the issues that are present during the day, which can just impact their sleep. So you have a child who has a good routine, has a good sleep, has healthy sleep habits, doesn't seem to have a medical problem, but still having troubles. So in those kids, it may be things like anxiety, it may be things like depression, ADHD, autism. So all those
Yeah,
conditions are sort of, what we call comorbid
come on.
conditions. They're
Yeah,
present and they can make sleep worse, with there's
across the
increased sort
board.
of exactly, so there's just this increased sense of alertness and children may have a harder time winding down, and so that can contribute to sleep issues as well. So I think when we use those three broad buckets, it kind of helps us know, okay, these are the things we need to work on. And many times I would dare say with ADHD it's a combination of all three.
Wow.
Mm,
Okay. Okay. So that's cool. That's really good to know. That is really, really good to know. So, what strategies in this case can be put in place to eliminate these issues? The non-medical issues, because if it's sleep apnea, we know we get to send
yeah.
to the ear, nose, and throat. If it's reflux, we get to treat the
Mm-hmm.
reflux. But for the kids who just have problems initiating
Mm-hmm.
sleep or persevering in
Mm-hmm.
sleep, what strategies can we put in place?
Mm-hmm. That's a great question. So with, of course, like you mentioned, the medical bucket, you always want to make sure you're not missing that, because you can't walk your way through that. You have to address it, right? So usually what I say, we start off with, let's go back to the basics. I think that is so fundamental to start with. And then once we build the right foundation, then we can start to say, what do we need to do moving forward? So, for instance, if you have a child who is either fighting bedtime, right? The first thing I usually would say is we need to first get some data. Is this a seasonal thing? Is there a pattern to it? Has this been going on for long? Is there changes, stressors? So we want to manage that. And then you want to try to establish a very consistent bedtime routine because children actually like things to be predictable. They want things that they can anticipate. And especially for children with ADHD, they need and they thrive on routines. So they know what is coming, especially for the younger ones. And in those situations, you may need to incorporate, a reward system. You may need to do like a chart where they're checking off what they're supposed to do. And you really want to also, as part of that routine, you really want to make sure that you start to create opportunities for them to wind down. So I know some families where maybe dad's been working all day and shows up at 8 p.m. and the kids are supposed to go to bed and it's like, oh yeah, let's play a quick game of basketball, you know?
Ah, that's not winding
No,
down. That's
that's not
winding up.
winding down. And especially for a kid. And then I also have parents who are like, well, this my child has too much energy, so we're gonna wear them out. And then they have them either on the trampoline at night just to try to get them exhausted. What that ends up doing is it
It winds
alerts
them up.
them more. So
Yeah.
you really want to start to set tone, maybe reading a book, having a bath, dimming the light. So those kind of routines are so helpful for children with ADHD. And you pack it up with rewards, with accolades, especially when they do the right thing. Um,
Yeah.
if then the other piece is consistency, because what that does is it helps kind of anchor our internal clock. We all have this internal clock or circadian rhythm. So you want to have your child know when it's bedtime and when they're supposed to be and when they're supposed to wake up. And you want to make sure that you stay within that ballpark, even on the weekends, so that they're
Yeah.
not just shifting all over the place. So that's
So
another
like
one.
summertime, like right now, the right idea would be not to let them stay up all night, would be to keep them on the school
Mm.
routine
Well, you
would be
can.
the better thing to
I usually would say it's hard, especially depending on what school and what age. If you have an older child, who goes to school and they have early school start times. I don't want them waking up at 5 a.m. because teenagers are delayed. They
yeah,
have a delayed, and that's
yeah,
another
that's
piece
true. That
for
is true.
even some children with ADHD. They may have a slightly delayed rhythm, so their bodies may not necessarily be able to fall asleep until later. So you may want them to get at least whatever sleep their body needs. Most times for those kids on the school routine, they are deficient in sleep. They're not getting enough sleep. So you want to focus on trying to optimize their sleep, but you still want it to be reasonable. I don't want kids waking up at 12 noon. It's
Yeah.
just not good for their body because then they're completely shifted. And then when it's time for them to go back to school, it's
It's
so hard. They
so hard. Yeah.
struggle.
What,
So yeah.
what I find with a lot of my kids
Mm,
is that they totally like there's no boundaries, no
yeah.
bedtime, and so they're going to sleep at 12, 1,
Yes.
2, and then they're sleeping till 12.
Yeah.
And so, by the time school starts back up, then they start having problems
Mm-hmm.
fitting back into getting back into the old
Mm-hmm.
routine. So would you advise parents in that case to still have them have a bedtime?
Mm-hmm.
It might be a little
Mm-hmm.
later, but not just let them just hang
Exactly.
out.
Exactly. So that is so key. And I think, if you're teen, especially the teenagers, I feel like the younger kids are still early risers. They'll still they'll still wake up very early for you. In fact, maybe a little earlier because they know it's summer and there's so many fun things to do.
Yeah.
But you still want to make sure there's an established wake up time, even for your teens. And this is the time where you could get them involved in different activities to get them out of the house, out of bed. Like, if there's summer camp, if there's places they could volunteer, if they could get a temporary job or whatever, something that gets them out and motivated, I think is so important because then it helps them with resetting their clocks for school. And I usually will say by like 9, 10 a.m., no matter what, you want them
Oh,
up. Again, otherwise you're just going to keep shifting. Our body, our that internal clock slowly shifts because it's a little bit, I mean, I'm
Yes,
getting a little
yes, yes.
nerdy. It's a little longer than the 24-hour clock, but we won't go there. But you don't want them drifting off because that's what will happen. So I
Yeah,
totally agree with you. You still want to set a time. And you may need to get creative because they don't want to go to bed early, but you may need to set a time when the devices go off. You may need blackout
yes.
shades if it's not too dark, especially for the younger kids. And early in the morning, you may want to do blackout shades. Otherwise, by 5 a.m., 5:30, they're awake. So
They're
you
up.
you want to incorporate those things. Yeah.
Okay, 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 okay. All right, that sounds great. So keep a good sleep routine, set up a good, bedtime routine, wind the kids down rather than wind them up.
Up. Yeah.
Keep them kind of close to their regular school routine so that when school starts back up, it's not a big problem. But what about the kids who actually fall asleep and then wake up in the middle of the night and
Good.
say they can't go back to
That's
sleep?
an excellent question. So that usually, depending on how long it's going for, is probably a sign of insomnia. And insomnia is it's a condition where sleep disorder, where we talk about difficulties falling asleep, staying asleep, as well as early morning awakening, right? So waking up in the middle of the night, I tell families, is normal. Everybody wakes up. Nobody sleeps through the night, actually. We
Yeah,
all go through sleep cycles. And so
yeah.
every 90 minutes or so, we have a brief wake up. So we wake up about 6 times at night. That's completely normal. The issue is, what does it mean? What does it take for you to fall back asleep? So if you have a child who's waking up maybe relatively frequently, but has a hard time falling back asleep, that's when we start to say, what is going on? And usually there's a couple of reasons why. There might be, again, a medical sleep disorder. So we want to make sure that's ruled out. There might be
Mhm.
anxiety or stress or something else going on. There might be environmental changes, especially in the summer, right? It's
Yeah,
hot right now. It is so hot, right? So kids are having a hard time getting that
yeah.
restful sleep. So you want to make sure those environmental things are not an issue there. Then we go back and say, well, how does the child fall asleep? Because it turns out that how we fall asleep is actually plays a big role in how we stay asleep. So if you're falling asleep with, if you're a young child and your parent is right next to you and you can't fall asleep on your own, then when you
Mhm.
wake up in the middle of the night, you're going to need that same setup to fall
Wow.
back asleep. So if you're falling asleep with a bottle, if you have a little child who's falling asleep with a sippy cup or whatever, when they wake up, they need that milk
They want
again.
that sippy cup back.
Exactly. So those are what we call sleep associations. So you do want to make sure that this is not because there's a sleep association going on. So if there is, then we got to just work on that bedtime, because in the middle of the night, nobody's going to learn anything. You can't sleep train when everybody's exhausted, right?
That is it.
So then we start to work on, how do we get your child to sleep independently, right? So that they can sleep. Because then if they fall asleep on their own and they wake up like everybody does, they're like, okay, I'm safe, nothing's going on, I fell asleep on my own, and then they can resume sleep on their own. So that's really it.
Okay. That is fantastic. I really, really I appreciate all these pointers. These are really, really good pointers. I'm sure all the parents um, hearing this are all going, amen. And hopefully they'll all go and implement um, at least one of these things that you've talked about. Because yes, it's true. In the summer, we let our kids get out of the routine. We sometimes allow them, actually not sometimes, more times than not, allow them to go to bed with their little devices. I'm a big advocate for actually shutting down the Wi-Fi before you go to bed so that they don't pretend, because I have a few really naughty ones who will pretend that they want to sleep, and then when mom and dad have gone to sleep,
They bring it up.
sneak back out, get that device, and then stay up all night.
Yeah.
So I'm a big advocate for like switching. If you need to do drastic things, switch off the Wi-Fi when you go to bed, and so the kid can go put it back on.
Mm.
And so there, I really appreciate it. This is really, really good. This is good.
Oh,
This is good.
glad to hear. I'm happy to hear that. Yeah.
So thank you very much. And I am actually going to like ask you right now um, to come back, and we'll talk a little bit more about sleep with regards to a few other things, like sleep with regards to anxiety and
Mm.
how it fuels anxiety and depression. So I'm going to ask you to please come back pretty soon so we can have that talk. This was a wonderful conversation here. Now, I also want to put it out there, put out a caveat that this is solely for educational purposes. this is not for diagnosis or treatment of sleep issues. This is just purely educational.
Yeah.
So thank you
Yeah.
very, very much, Dr. Afolabi-Brown
Absolutely. Thank
of
you so much. So much for having
Restful,
me.
Restful Sleep MD.
Yeah.
So please visit her. You do have a
Yeah.
website. Can you tell us how to reach you?
Oh, yeah, absolutely. Yeah. So I'm on Instagram, so you could just hop on my channel to learn more because, like you said, there's so much when it comes to sleep and ADHD in kids. So we just scratched, and I'll be happy to come back. We'll just scratch the surface today. But I do have a sleep summer series that's coming up, and that was why this what you just said was what really motivated me. Like you said, everything just goes haywire in the summer, and then we're like, oh my God, school is starting, and we don't know where to start. So I have a summer series, a three-part summer series. The first one is on July 15th. It's at 9:30 a.m. Eastern. It's going to be live on Zoom, and we're going to really be talking about sleep for moms because that's a group of people, the most important group of people as far as I'm concerned, that nobody talks about. And so really it's focusing on how moms can get the rest they need so that they can be really present to implement everything we talk about in their children. It's completely free. You just need to register on my website, restfulsleepmd.com. And yeah, and I look forward to just sharing this with moms out there because when we are best rested, then we can help our kids rest well. And you can follow me on Restful Sleep MD on Instagram too. So thanks for having me.
Thank you very, very much for coming. And I'll put that information also in the caption so that all so that people coming afterwards who didn't get to hear the whole thing can actually sign up and come for that masterclass because I think it'd be great. I'm going to sign up for it too.
Yay.
So thank you very much, and please come back soon.
Absolutely. Thank you.
Bye.
Bye.